I'm Abby Phelps, and today I'll be going over the gold standards for COPD exacerbation. And this is my first video identifying COPD. So, what is COPD? So, COPD is an ongoing lung condition caused by damage to the lungs. The damage results in swelling and irritation, also called inflammation inside the airways that limit airflow in and out of the lungs. This limited airflow is known as obstruction. Symptoms can include trouble breathing, a daily cough that brings up mucus, and a tight whistling sound in the lungs called wheezing. COPD is one of the top 3 causes of death worldwide. Emphysema and chronic bronchitis are the 2 most common types of COPD. These 2 conditions usually occur together and can vary in severity among people with COPD. Although COPD is a condition that can get worse over time, COPD is treatable. With proper management, most people with COPD can control symptoms and improve their quality of life. Proper management can also lower the risk of other conditions linked to COPD, such as heart disease and lung cancer. So, what are some causes of COPD? So, most common cause of COPD is smoking cigarettes. Usually, anytime I've been in clinical, any patient that I've had that has had COPD has had a smoking history. So, this is by far the most common reason people get COPD. You can also get it from other tobacco products such as cigar and pipe smoke, especially if you breathe in the smoke. Secondhand smoke, even if you aren't a smoker, you can get COPD from living with one. Pollution and fumes, you can get COPD from air pollution. Breathing in chemical fumes, dust, or toxic substances at work can also cause it. Your genes, sometimes in rare cases, people with COPD can have a defect in their DNA, the code that tells your body how to work properly. This defect is called a AAT deficiency. When you have this, your lungs don't have enough protein needed to protect them from damage. This can lead to severe COPD if you or a family member had serious lung problems, especially at a young age. Chronic lung infections, so recurrent lung infections during childhood, may increase the chance of developing COPD. Asthma, so poorly controlled asthma can raise the risk for developing COPD. So, what are some tests/symptoms used to diagnose COPD? So, common symptoms that you would see in the clinical setting is dyspnea, so difficulty breathing, a chronic cough, which is one of the first symptoms of COPD that can present every day or often throughout the day. Sputum production. Patients can raise small quantities of tenacious sputum with coughing, wheezing, and chest tightness. So, patient can have inspiratory and expiratory wheezes and chest tightness that can vary between days and over the course of several days. A common one is fatigue, so it'll make a lot of the patients tired or exhausted. One of the more rare symptoms is weight loss and muscle mass loss. And then another common one is depression. A lot of patients get depressed due to the fact that they aren't the same as they used to be. Just not being able to do the things that they want to do just due to not feeling well overall and being in and out of the hospital. So, what tests/symptoms are used to diagnose COPD continued. So 3 common ones are PFT, chest X-ray, and CT scan. So PFTs give you a really good, like they really help with diagnosing your patient that has a COPD. So it includes different kinds of breathing tests that measure how well your lungs exchange air. So how well your lungs help you take air in and out. There are many different types of PFTs. Some measure how well your lungs absorb oxygen into your blood and also how exercise affects your lungs. Chest x-ray. So some chest x-rays may show lung changes from COPD. An x-ray can also rule out other lung problems as well, or heart failure. A CT scan combines x-ray images taken from different angles to create images of structures inside your body. It gives you a way greater detail to help diagnose your patients that has COPD. It's a whole lot better than a chest x-ray. And it can also scan your lungs, which helps finding emphysema and chronic bronchitis. An ABG, so this blood test measures how well your lungs are bringing in oxygen into your blood and removing carbon dioxide. An AAT deficiency test, kind of like what we talked about earlier, blood test can tell if you have a genetic condition called AAT. Blood tests aren't as used as much, aren't used to diagnose COPD, excuse me, but they may be used to rule out the cause of your symptoms or rule out other conditions that you may have. So GOLD grades and severity of airflow obstruction in COPD patients. Most bronchodilator FEV1/FEC ratio of less than 0.70 is used to confirm persistent airflow limitation. FEV1 is the maximum amount of air you can forcefully exhale in 1 second. And when you do, it is measured using barometry, PFT. So that's how you get these numbers. And so there are 4 different levels. So mild, moderate, severe, very severe. So GOLD 1, which is mild COPD, so an FEV1 of 80% or more. GOLD 2 is moderate COPD, so FEV1 between 50% and 79%. GOLD 3, which is severe COPD, FEV1 of 30% to 49%. And then GOLD 4, which is very severe COPD, which would be less than 30% for FEV1. Right, so we went over what is COPD, what are some common causes of COPD, which is the main one is cigarette smoking. What are some test symptoms used to diagnose COPD? So the 3 most popular, PFTs, chest x-rays, and CT scans. And then we went over GOLD grades and severity of airflow obstruction for your patients.